pag-uusapan po itong spirulina pa rin as agonist on some maintenance drugs. Napakaganda po ng ating topic ngayon. At syempre, para mas maunawaan natin yan, topic na yan, makakasama po natin Doc Joseph Lee in the house. Yeah.
Ang tanong, Doc, pwede ba to pag may iniinom akong maintenance?
Totoo yun.
Baka salungat, di ba?
May contraindication ba?
Contraindication. Baka mapasama ang aking katawan, no? Kung iinumin ko to sa relative ko, Rina, baka namang magkaroon ng adverse effect. Diba? Namin pag tinanong ni Erica,
mga hindi magandang reaction.
Complication, baka madala ko sa hospital, mapagbintangan ako,
baka mas
diba?
lumala pa.
Sometimes, we give things to our relatives or friends, then maging problema. So we do not want that, no? So we talk about why spirulina is a very good agonist. When you talk about agonist, it's a sharing of function and activities that can be useful, diba?
Okay.
Pag antagonist talaga kasi
kontrabida.
Kontra yan, hindi pwede at maaring magkaroon ng adverse reaction. But when you have agonist, the term agonist states that it can be supplemental, it can further activate, it can act as an deactivator or activation of a certain activity of a function of a certain ingredient. No? Anong ibig sabihin? Kung yung organic substance mo like spirulina is there with very strong ingredients, minsan kasi ang gamot na natin na iniinom na mga ating mga comorbid individuals like diabetes, hypertensive, those who are constantly on hypercholesterolemia, ibig sabihin ng lagi kasing kumakain ng mga fatty foods kaya ang cholesterol hindi na bumababa masyado, di ba? So, yun ang mga tatalakayin natin ngayong umaga.
Okay.
No? Those are the three or the more common or paulit-ulit perennial problem of people globally, diba? What are the substances that are very, very good indeed, especially if you talk about them helping or they become very sufficient for patients who are taking maintenance, no? You have your phycocyanin. Okay, I talked about it last week. You have your polysaccharide. Di ba yung polysaccharides natin, yung sinasabi ko, if you remember, your full sulfate polysaccharides are very good for penetration to the viral wall. Di ba? Okay,
yes.
That's it. Then you have your linoleic acid. Okay, i-mention ko muna isa-isa very slowly. Linoleic acid, that is an acid. Fatty acid molecule, okay? Then you have your phytochemicals like your phytophenols, okay? Okay. Doc, explaining mo na kasi sabihin nyo, hilong dito na kami sa ingredients. Why did I pick these ingredients? Because these are the ingredients which are very important in supporting our maintenance, especially if you are hypertensive, especially if you're diabetic, especially if you have hypercholesterol. Okay. Now, your phycocyanin has a strong activity wherein it can be a inducer for anti-inflammation or antioxidant, 'di ba? Importante 'yan kasi bakit? Pag sinabi anti-inflammation, kailangan mo 'yan. If you are diabetic, you are very prone to a systemic problem. Like what? Diabetic gangrene, diabetic retinopathy, di ba? Diabetic retinopathy, no? Or nephropathy, ibig sabihin nasisira ang kidney, nabubulag ka, nagkakaroon ka ng gangrene, di ba? Umiitim yung mga toes mo.
Yes.
Parang nag-iiba yung tsura ng balat.
Oo, tapos yung mga ugat mo, di ba, parang kailangan mo na i-declog lagi because of problems with your vascularity o yung vessels mo. Now, your phytocyanin is very good in repairing or reepithelialization. What does that mean? Kung nasira man because of your condition, because you are diabetic, no? Because you're diabetic, nasira ang ugat mo. Yung ugat, yung the vessel, it can repair it very easily, no? Once it repair it, it prevents it from inflammation. So yung inflammation na na-mention ko kanina, yung mga different causes of diabetes in the future if you are diabetic. Remember, diabetics are dalawang klase. Diabetic type 1, which is insulin dependent, which is congenital. From the very start, your pancreas is not functioning yung insulin niya. Dapat ini-inject. Yung mga nag-i-inject. Yung type 2 is the adult type. Ayun sinasabi ko minsan, Angela, Rina, Erica, ikaw ang may kagagawan yan. Anong
pag mo isisi sa iba.
Nako, ibig sabihin, may history kayo ng pamilya nyo ng may diabetes, ikaw naman, kain ka ng kain ng matamis. Diba? At the end of the day, if you have a risk factor, it will trigger you, and by the time you get 40 or 50s, diabetic ka na rin.
Mas grabe ba yung type 2? Mas grabe.
No, hindi. Usually kasi yung diabetic, yung type 2 kasi merong kapang function yung pancreas mo. The pancreas is where you have the insulin that controls the sugar. No, may function pa rin pero hindi na masyado because you have a circulating problem because of the intake or exogenous intake of food. Mahilig ka sa matamis. Alam mo lahat ng matamis na food sa mundo. Alam mo kinakain mo na. No? So ibig ko sabihin, lagi ko sinasabi, type 2 is your fault, no? So if it's your fault, then you have to have oral medication. Oral usually ang medication yan. Oral.
Metformin.
Yan, tama yung nabanggit mo. So yung spirulina is very good in helping your metformin. Not only your metformin will lower the blood sugar, now the content of your phytocyanin or your cyanin that is present in your spirulina can help repair the destroyed vessels, improve the flow of your dugo mo. Yung dugo mo maganda ang flow at hindi siya magiging detrimental in the future if you are diabetic per se. Diba? So, hindi mo mararanasan probably yung mga diabetic gangrene. Malay mo yung sugar levels mo mag-i-improve because of that. Then we go to the other ingredients, which is your linoleic acid. So, what is the function of linoleic na kagaya na pwede siyang gamitin sa antiviral? It's very good because it's a very good lipid, no? Ang fats kasi natin, meron hindi maganda, meron maganda, no? Your linoleic helps you to attach to the not so good cholesterol. So ano mga not so good natin? Yung low density lipoprotein, 'di ba? Yung LDL, naririnig nyo. And you have your high density lipoprotein, yung HDL. HDL kasi medyo okay. Ang LDL ayaw natin. Bakit yung LDL? Kasi ang LDL kasi pag marami yan sa system natin, you can cause atherosclerosis. Namumuo yung dugo mo, you get clots and you have problems. Cholesterol plaque. Yung naririnig nyo, cholesterol plaque sa puso, cholesterol plaque sa daanan ng ugat natin. Okay. What is nice about your linoleic acid in spirulina? Because it brings down the lipid peroxidase process. What is lipid peroxidase? Ito kasi nagko-control ng total cholesterol mo, ng LDL mo, ng HDL mo. Parang sabi niya, oy, mag-ayos kayo. Kailangan ito lang ang dapat. Kasi pag nag-overshoot ang ating fat sa ating katawan,
anong pwedeng mangyari?
Sa ating atay, you have a lot of fat, and your liver cannot process that, you will end up having fatty liver. Narinig nyo? Mataba ang
yun
atay
pala
mo.
yun.
Ang atay mo, ang taba-taba. Yun, di ba? Yun ang fatty liver. Minsan, di ba, Angel, pag nag-ultrasound tayo, Dok, bakit nakalagay dito mild fatty liver? Hindi naman ako kumakain ng taba. Are you sure? Or there are things that you do not process very well. So, the linoleic in your spirulina can control that. So, what is it good? So, kung ikaw man ay laging hypercholesterolemic, di ba? nagme-maintenance ka ng mga cholesterol drug, nakakatulong siya. 'Di ba? Erica, Rina, nakakatulong siya. So nakakatulong siya ngayon diyan. So maganda 'yan. Okay. So we go to the next ingredients that yung na-mention kanina ni Rina. Is it a vasodilator? Can it be a vasodilator? Yes, because you have your phytochemicals like your phytophenols, which increase your nitric oxide. Okay? When you increase your nitric oxide, okay, ito importante to. Importante yan lalo na sa mga kalalakihan, di ba? Erection, nitric oxide, kailangan mo yan. Okay, oo. Pag nag-vasodilate ka, makokontrol mo ang BP mo. Tumataas ang BP kasi vasoconstrict. Ibig sabihin, naiipit ang yung diameter ng lumen ng ating arteries kaya tumataas ang blood pressure, no? So, your phytophenols or your phytochemicals which are present in your spirulina not only cause vasodilation, in its more beneficial way, it is also very good in increasing your nitric oxides. Okay, it is very good, of course, for men who have erectile dysfunction because you know naman the male genitalia is very vascular, no? It prevents, no, your phytochemicals or your phytophenols prevents more endothelial damage, no? Like your phytocyanin, yung kanina na-mention ko, pine-prevent niya yung destruction ng endothelium. Your endothelium is part of the layers of your blood vessels, okay? No, plus the fact that pag nakita mo nag-vasodilate, pwede siyang makatulong sa patients who are hypertensive at nagme-maintenance ng mga hypertensive drug. At least maka-help siya, no? So if you're talking of a organic supplement that is not only to increase your immune system, at least in its way nakakatulong siya sa maintenance. Kaya minsan sinasabi natin, Angel, Rina, Erica, bakit at some point in time pag matagal ka na maintenance at meron kang ini-introduce na other supplements, nagre-regulate na yung mga blood sugar mo, yung BP mo, umo-okay na. Tapos ano ba sinasabi ko? Yung sugar, tapos yung cholesterol mo. Anong gagawin mo pag bumabalik ka sa doktor mo? Ano sinasabi? Dok, pwede bang hindi ko na inumin yung mga maintenance? 'Di ba? Kasi ayaw nyo na yan eh. Let's say if you're drinking it for 3 years, 5 years, 'di ba? Okay, siyempre ang gagawin ng doktor nyo sasabihin, sige, gradually we do that. Okay? So, lagi natin sinasabi, probably some of the organic supplements that we drink, like supplements, can be agonistic in itself kasi nakakatulong. It doesn't mean that if you have spirulina, if you want to take spirulina, hindi ka na magme-maintenance. Ang sinasabi natin kasi, maaring in the future, makatulong siya at makaganda na mabawasan na later on yung maintenance mo at maka-help instead also to your body system, which is good. So that is why when you talk about yung agonistic effect niya, maganda. Like yung sinasabi natin kanina, you talk about we pick diabetes mellitus. Why is it very important? Okay? Kasi your linoleic that is present in your spirulina controls now your lipids, di ba? It improves the lipids, it improves and controls your LDL, your HDL. Pag na-improve yan, ano mangyayari? No? It in itself, it regulates your insulin, or it can stimulate your insulin that is not functioning that well, or 50% from the pancreas, di ba? So this is linoleic or your phytocyanin, di ba? sabi natin phytocyanin, maganda yan sa diabetes, di ba? So pwedeng matulungan niya kung ang insulin natin ay hindi naman masyadong nagwo-work or sinasabi natin 50% pa lang. So pwede niyang i-boost, no? So in itself, it can help na yung mga nagte-take ng maintenance drug for diabetes to improve themselves and to regulate their blood sugar in the body, okay? Because you have this substance that are very good, okay? So, I will repeat, pag diabetic ka in spirulina, what are the agonistic ingredients that can help your maintenance? You have your phytocyanin, your linoleic acid, and sometimes your polysaccharides can help. Yung sinabi ko, yung antiviral din, no?
Oo.
Now, for patients who are hypercholesterol, limia, mataas ang cholesterol, you have your linoleic and your phytochemicals. Patients who have hypertension, you can have your phytochemicals, yung phytophenols natin, and your quercetin, no? Or your quercetin, na pwede natin gamitin na all are present in your spirulina. Okay.
Having said that, Doc Joseph, does it mean na kunyari ang time ng inom ko kunyari ng maintenance medicine ko, not that I have maintenance
High maintenance lang siya.
Kunyari is 8 o'clock in the morning, no? Okay lang nasabay ko yun inumin or maganda pa rin na may interval, Doc Joseph?
Maganda yan na tanong, no? Ang maintenance natin have a certain period of time that you have to drink, di ba? Now, with regards to organic supplements like spirulina, can you follow your maintenance, okay? You can follow or you do not need to follow. Kasi most of the time, when you have organic supplements, there are 2 intervals which are very, very nice for them. One is in the morning. You drink it in the morning because you go to work. So your body system will need whatever ingredients or nutrients that you have in your organic supplements like your spirulina. And the other timeline that you can give your, like say your spirulina is in the evening. Di ba, Angel? Bakit gabi? Kasi gabi, doon nagsha-shutdown ang factory at andoon na lahat ang mga repair. Yung mga repairs, natin, yung mga tauhan natin na nagre-repair.
They're getting to work.
Ayan na, sabihin nila, okay, meron dyan magmamando. Tingnan nyo lahat ang mga sira ng organs. Dapat nating i-repair lahat yan bago mag-umaga. So, you can give spirulina if you're taking spirulina in the evening, or you can take spirulina in the evening because it is approximately the duration of your repair and rejuvenation and your metabolic mobilization or your system for those that have been destroyed, no? Now, in the morning also. Now, if and when that you want to have additional supplement during the time that you are taking your maintenance, Angel, pwede mo rin siyang isabay. There is no problem with that. Parang gusto mo lang na, parang makaboost. Ngayon sinasabi mo, Doc, pwedeng, sinabi mo kasi nakakatulong, agonistic. Can I take it during my supplement? There is no problem with that.
By all means, pwede. I love
Malinaw.
it. Malinaw. Yes. Ito ang Pasig City. May katanungan ako, Doc Joseph. Pardon the ignorance lang, How about for those undergoing yung dialysis? Is it also, pwede rin ba sila mag-take nito? Itong spirulina? Could it help them? It's all about brainy.
Very good. Ito ngayon, ang depende yan sa iyong specialista o nephrologist, diba?
Makakatulong ba sa treatment?
I'm not saying that all are amenable or want you to take, di ba? There are some nephrologists who want. There are some nephrologists who doesn't. Ganun naman ang lagi yan, di ba?
Kanya-kanyang ano.
May iba naniniwala, may iba hindi naniniwala. So we take it as that. We don't force your doctors. Now, it is very important that if you have a friend that is undergoing dialysis and you recommend spirulina, that they can show it to their doctor. Okay?
Ask your doctor first.
A doctor. But pag ako kasi, kung akong tatanungin mo, during the process of dialysis, siguro wag mo munang inumin kasi malilinis din siya. So what's the use?
Sayang.
So pwede mong inumin after na. Okay?
Para
Makes sense naman.
Diba? So, kasi wala rin, iwawash off. Parang, kunyari,
Sayang naman,
pinasok
diba?
mo.
Oo, idadialysis
naman,
ka.
totoo.
Diba? Parang ngayon, tapos dumaklak ka parang natatakot. Alam mo yun, it's like a protective blanket for you, pao. Eh ano ngayon, ililinisin naman ang dugo mo eh. So what's the use? You cannot, you cannot get much of the action of your organic supplements with that, no? So, you
Wash
take it
off
after na lang.
Okay. Rinse.
Doc Joe,
Okay.
what about yung sa may mga autoimmune disease naman, like yung mga MS, lupus, kasi di ba we all know na itong sclerosis,
GBS.
yung ano naman yung spirulina natin mataas sa amino acid, di ba? It can boost your immune system. But the thing is that dun sa sakit ng MS tsaka autoimmune, yung immune system mo ang kumakain sa sistema mo, sa sarili mo, kaya it makes your condition worse, di ba? So can you consider spirulina giving it to patients with autoimmune disease, or bawal siya with those with autoimmune disease?
Yeah, I think we can give it as a collateral supplement.
Kasi supplement
because,
naman
Oo, kasi una-una kasi lagi mo sinasabi kung ang purpose ng spirulina is to boost your immune system and to control like a very good modulator, no? When you say immunomodulator, we have drugs that are very good immunomodulators, like for cancer drugs and other autoimmune, di ba? Mga interleukin, interferon, those are very, very expensive drugs, no? So instead of those, na you can have a combinant agonistic effect for spirulina para at least makatulong man, no? Where we are not saying that it might give you 100% workability, but it can give you a few percentage, no, like 40, 50, na nakakatulong para hindi man malagasan yung alam mo yung lakas mo, yung body resistance mo because of your autoimmune disease, no? Kasi once it comes in, no, hihina ka eh. There is body weakness, 'di ba, Angel? There is body weakness. So you do not like that. Kasi once there is body weakness, you are prone to a lot of infection. So in order to obviate that, uminom ka na something na parang palalakasin ka pa rin. Para naka-stand up ka para, lalabanan ko kayo, no? Not necessarily erasing the fact that you have already autoimmune disease.
Yun. And then, Doc, I have one last question. Na-curious lang ako kasi naalala ko nga sa mga discussions mo dito sa spirulina as a superfood, diba? Super supplement siya. It also boosts your energy. Yeah. So, I was wondering, if you take it in the night, would this affect your sleeping pattern?
Ooh. No, very good. It doesn't affect, it improves your sleeping pattern.
Mas mahimbing.
Kasi meron siyang mga ingredients na parang melatonin or serotonin effect. No? It might not have much of your vitamin B12, no? Hindi siya, meron siyang mas marami siya yung riboflavin, yung cobalamin, no? Yung mga B1, yung riboflavin, yung B1, B2, and your B6, no? Wala siya masyado yung B12. No? So yung B12 natin kasi ginagamit natin sa mga ugat, no? Ang rami, no? Pag sinabi B complex, ang dami.
Kaya pala
your vitamin B10, no, Angel, pag B10 ang pinag-uusapan, that is being used for cancer. Yun ang naririnig mo yung siguro sa ano ni Mami ni Diego, yung infusion of vitamin
Yes.
B10. That's B10,
Yes,
no?
they do
We
that.
don't talk about that, but that's part of the B complex when you talk about the B complex. So
It's
you have
so
1, 2,
complex.
diretso. But what is nicer when you talk about your sleep to help you, because you have a lot of phytochemicals like your anthocyanin. No? Your anthocyanin, which is prevalent especially in berries. Alam mo yan.
Yes.
Diba? We know some berries that that's why it keeps you on a medyo deep sleep, or yung REM, yung REM natin sinasabi, no? Mas maganda ang tulog mo on that. Pero hindi tulog na yung parang
Kasi po hindi ka nagigising.
wala nang gising. Yun.
Oo.
Parang wow, 'di ba meron tayong wow,
Quality yung
sarap,
sleep.
Yeah, exactly. Quality sleep. Yeah.
Sabi naman yung
know.
araw, ayaw nang magising,
Basta,
Oy, may
basta ang
gano'n.
major takeaway dito, wag po kayong mag-alala kung may mga maintenance medicine kayo dahil wala
Yes.
namang contraindication kung kayo ay uminom ng spirulina.
Hindi
kasi
siya kontrabida.
Ang importante kasi it is organic. That's number 1.
Yes.
Second, the ingredients that are strong ingredients does not interact on your drugs. No? Mahirap lang kung drug-to-drug interaction. Yung ibang drug. No? Yun ang mas nakakatakot. Kasi
Paglaban.
they are chemically formulated. So, ibig sabihin ng chemically formulated, Rina, Erica, Angel, you have to know that in-adjust mo yan.
Yes.
In-adjust
Ano na
ng
siya?
tao. Ito kasi, hindi in-adjust ng tao. Talagang nandyan. It is naturally
Organic.
based.
Kaya pala
May
siya
halo
green.
na yung iba kasi.
Clean green, nature.
Chlorophyll.
Ayun.
Nature.
Ang daming benefits I love it. Ano mapansin ko, parang mas refresh ang gising ko nung nag-take ako nung itong spirulina. Wala lang, masabi ko lang. I love it. It's so
Very
good.
good.
Oo, diba? Siyempre. Dahil dyan, thank you so much, Doc Joseph. Marami kaming natutunan. I'm sure yung ating mga kasangbahay
Thank you.
ay naengganyo ulit dito sa benefits ng spirulina. At para na rin dun sa mga nagme-maintenance sa medications.
Okay. Genesis Organic Spirulina is a high-quality premium nutraceutical enriched with organic quality ingredients for immune boost. Improve resistance to viral, bacterial, fungal, and parasite, and primarily carcinogenic substance. It is an effective antioxidant which has natural cleansing and detoxification effect and has complete nutrition and energy and body vitality. It is fully accredited and certified. For inquiries and orders, please contact 0931-781-1486, 0930-603-4831, 0951-080-9627. It is also available online and selected outlet nationwide.